Welcome everyone to our Dental Hygiene Boards Prep audio series. I'm so excited to help you master the material you need to excel in your exams. Throughout our series, I'll share tips, tricks, and memorable ways to retain important information. Whenever I come across tricky terms, I'll explain them, and we'll go over everything in a clear, organized manner. Each episode will be titled by topic for easy navigation. Let's dive into today's topic: infection control. Alright, let's start with infection control. This is crucial for maintaining a safe environment in dental practice. First, we have the term biohazard waste. Biohazard waste must be disposed of properly because it's regulated. Examples include sharps, items contaminated with blood or saliva, and tissues removed from patients. Next, we have material safety data sheets, or MSDS. These sheets provide information about the hazards of chemicals used in the office and how to protect yourself from these hazards. Then there's personal protective equipment, or PPE. PPE includes barriers like masks, gloves, protective eyewear, and impervious clothing to protect the operator. For masks, change them when they become wet or moist, and between each patient. Gloves are used for each patient. Protective eyewear can be face shields or eyewear with side shields. Impervious clothing means it doesn't allow fluids to pass through. The purpose of PPE is to minimize exposure to four things: aerosols, spatter, direct transmission, and indirect transmission. Aerosols are invisible airborne particles that stay in the air for a while. Spatter, on the other hand, is visible airborne particles of blood or saliva that settle quickly. Direct transmission occurs through direct contact with infectious agents, saliva, or blood, while indirect transmission happens through contaminated objects. Moving on to disinfection. Disinfectants kill most pathogenic microbes, but not spores. Important qualities of disinfectants include being rapid, broad-spectrum antimicrobial, odorless, easy to use, fast-acting, economical, and surface-compatible. There are different types of disinfectants. Chlorine-based compounds are corrosive and have a strong odor. Iodophors can discolor surfaces. Phenols leave a residue. Think Lysol here. Quaternary compounds are non-corrosive, but have a lower kill spectrum. It's important to note that glutaraldehydes should not be used as surface disinfectants due to their toxic fumes and corrosiveness. There are 3 levels of surface disinfectants: high level, intermediate level, and low level. High-level disinfectants are used in surgical areas. Intermediate-level disinfectants are used in dental offices. Low-level disinfectants are used at home and are not suitable for dental offices. Now, let's talk about sterilization. Sterilization kills all pathogenic microbes, including spores. There are 3 methods of sterilization: chemical, dry, and steam. For chemical sterilization, the conditions are 20 minutes at 270 degrees Fahrenheit and 20 to 40 pounds per square inch. However, it requires good ventilation and may damage rubber and plastics. The spore test for this method is Geobacillus stearothermophilus. Dry sterilization involves conditions of 60 to 120 minutes at 320 to 375 degrees Fahrenheit. It is recommended for metal instruments, but not suitable for paper, rubber, or plastics. The spore test here is Bacillus atrophius. Steam sterilization operates at 20 to 30 minutes at 250 degrees Fahrenheit, 121 degrees Celsius, and 15 to 30 pounds per square inch. This method can corrode non-stainless steel, dull instruments, and cause paper packages to become wet and tear. The spore test for steam sterilization is again Geobacillus stearothermophilus. Preparation for sterilization includes cleaning instruments in an ultrasonic cleaner for 10 to 12 minutes to reduce the risk of puncture wounds from manual scrubbing. Avoid overloading the autoclave and use appropriate packaging materials, placing items properly to ensure sterilization. Biological indicators, or spore testing, should be done weekly to ensure the sterilization cycle reaches the necessary temperature and pressure to kill all microorganisms. Next up, we have patient assessment. Start by reviewing medical and dental histories. Classify patients using ASA guidelines and contact the patient's physician if there are any questions about their medical history. Record vital signs and know the normal ranges: blood pressure, pulse, and respiratory rate. Key patient information to collect includes whether they are under physician care, have been hospitalized in the past 5 years, and why, their current medications and the conditions they treat, tobacco use, pregnancy status, and their chief complaint for the dental visit. Let's talk about dental charting using the GV Black classifications. There are 6 classes. Class I involves pits and fissures on the lingual surfaces of anterior teeth, and on the occlusal, buccal, and lingual surfaces of posterior teeth. Class II includes proximal surfaces of posterior teeth, often involving the occlusal surfaces. Class III covers proximal surfaces of anterior teeth, not involving the incisal edge. Class IV involves proximal surfaces of anterior teeth and the incisal edge. Class V refers to the cervical third of the facial or lingual surfaces of any tooth, typically root caries. Class VI involves the incisal edges of anterior teeth or cusp tips of posterior teeth. Lastly, let's cover occlusal relationships. Here's how you can identify them. Class I, or mesognathic, is the normal molar relationship where the mesiobuccal cusp of the maxillary first molar aligns with the buccal groove of the mandibular first molar. Class II, or retrognathic, occurs when the buccal groove of the mandibular first molar is distal to the mesiobuccal cusp of the maxillary first molar by at least the width of 1 premolar. Class III, or prognathic, happens when the buccal groove of the mandibular first molar is mesial to the mesiobuccal cusp of the maxillary first molar by at least the width of 1 premolar.